Have you ever wondered how surgical instruments are properly sterilized? Infections can occur without proper sterilization. Today, we will simplify the sterilization process. Our goal is to ensure patient safety through proper technique. First, gather your sterilization supplies. You'll need an autoclave, sterilization pouches, and indicators. Make sure all instruments are clean before you start. Next, load the autoclave correctly. Space instruments at least 1 inch apart. Ensure nothing blocks steam circulation. This is vital for effective sterilization. Now, set the correct parameters on your autoclave. For most instruments, use a pressure of 15 psi. Maintain a temperature of around 121 degrees Celsius for at least 30 minutes. Always refer to the device instructions for specific settings. While sterilization begins, monitor the process. Check the sterilization indicators placed inside pouches. They change color when proper conditions are met. This visual confirmation is crucial for safety. When the cycle is complete, let the autoclave cool down. Open it carefully to avoid burns. Wear protective gloves while handling sterilized instruments. Finally, store the sterilized items in a clean area. Keep them sealed in pouches until use. This prevents any recontamination before a procedure. To summarize, gather all necessary supplies, load the autoclave, set parameters, monitor closely, and store properly. Following these steps ensures patient safety and infection control. Now that you know the process, practice what you've learned. Being meticulous in sterilization plays a vital role in healthcare. Thank you for watching.